Good evening and welcome, everyone. My name is Erica Moore. I'm the Assistant County Manager for Communications and Public Engagement. I wanted to thank you for taking the time to join us here tonight to help us kick off the review of Virginia Hospital Center's proposal for a wellness and behavioral health facility on Carlin Spring Road. We are very glad that you are here. I am here to be the least important part of your evening. I am all about logistics. We are joined tonight by two members of our county board, Vice Chair Maureen Coffey and board member Susan Cunningham. Mark Schwartz, our county manager, will also be speaking to you tonight about the proposal, and they'll be joined up here by county staff from the Department of Community Planning, Housing and Development, as well as the Department of Human Services, along with a representative from Virginia Hospital Center and the Planning Commission member that will chair the site plan review process for this project. Additional county staff are also in attendance tonight. They are out in the lobby and they will be available once the presentations conclude. And we welcome you to join us there where you see the boards, as well as in the conference room across the lobby where you can ask questions and connect with staff. So with that, I am going to turn it over to board member Susan Cunningham, and thank you all for being here with us tonight.
Great. Well, it's great to see everyone. I'm glad we have no tornado today. It's a much improved day from the last time. And thank you, Erica, for getting us started and working out the technology challenges as well. I'm Susan Cunningham, and I have the privilege of serving on the Arlington County Board with my colleague Maureen Coffey, and of being the board's liaison to this project. So thank you all for being here tonight and taking the time to participate in this important community conversation that will neither start today nor end today, but is an ongoing one. And I do want to start by emphasizing what today is. Tonight is a beginning. It's not the end. It's a beginning of conversation in the site plan process to bring together all of the community's input into a site plan. So it is not a decision point, but a jumping off point. And the public process is designed to be open, transparent, enable some back and forth. We do not always all agree with one another, it turns out, and that can really improve the process. So your presence here matters and your voices will matter throughout the process. Behavioral health and wellness are hugely critical issues for Arlington. Our community lives and thrives on health, on mental health, and we all owe it to each other to be there to support it. Every day we hear from our residents about the need for better access to care, for more appropriate settings for treatment, and for stronger systems of support for individuals, families, and their extended networks who are navigating mental health challenges. And that can be any and all of us at any given moment, and any and all sitting next to us at any given moment. So this proposal is part of a broader effort to respond to those needs thoughtfully and responsibly, and many of you in the audience, and seeing Ms. Anita Friedman amongst many others, have really been leading that charge the last couple of years to respond to urgent needs and to meet the moment, and this is an exciting step forward. At the same time, this kind of development process always raises some anxieties and some concerns and some conflicts. So I want to name that, whether it's location or scale, design, operations, they're all good questions. And we hope you will bring them and voice them and listen and have dialogue so that we get it as right as possible. The county board's role is not just to evaluate a proposal on paper or at the very end, right up here on the dais, but to keep track throughout and to hear from you, and if things go sideways, to weigh in earlier and help get us forward. Tonight, you'll hear much more about the site, the concept for the facility, and how the review process will work. You'll also have opportunities to start to share your perspectives, what excites you, what concerns you, and what you think we should be paying particularly close attention to on this project. So thank you all for being here tonight and for helping us begin this process in collaboration and respectful dialogue. I look forward to the conversation ahead, both whatever Mark's gonna say, because I'm not exactly on time, and all the conversations at the end of the day. So with that, I will turn that over to our esteemed county manager, who will provide some helpful context. It says you must be providing helpful context. Can you guarantee? Okay, about the project.
Thank you very much. Good evening to everybody. Recognize a lot of faces in the audience, and so glad that you were able to make it out this evening. So I'm going to talk a little bit about context on the site, and I think most of you, if not all of you, know where it is on South Carolyn Springs Road and its previous use as a site for a medical facility. Not all of you may know, had been a 225-bed hospital was on the site. So the idea of having a medical use on the site isn't new. And then what this involves is a proposed partnership between us and VHC Health, as Susan mentioned, for a rehab and behavioral health wellness facility. And so what's going to happen in terms of the building, you're going to have a lot of opportunity to talk a little bit about the scale, the layout, traffic patterns, environmental impacts, and design that is anticipated, that's been shared already by the applicant. And I think Adrian and Rich are going to go through that tonight. And that I did want to talk a little bit, because some of the questions have come up about the portion of the land that's remaining and sort of what our partnership has been so far. In the CIP that the county board adopted 2 years ago, and we have another round coming up, we talked about this explicitly, about how the county is sharing in some of the parking costs on the site, so that we're very keenly aware of some of the parking challenges there, not only for the county and VHC, but for future site development. We also talked about, we put some money in the CIP for connections to the Long Branch Nature Center and re-envisioning that part of the site. So that's already adopted county policy in the CIP from 2 years ago. I'm going to be proposing a new CIP next month, where I anticipate to carry on some of these commitments. So with that, I think that you'll all know a little bit more probably than I do about the site plan review process and what's going to be coming forward with the Planning Commission and County Board. So please tonight, I know none of you will be shy. Please ask whatever questions you have. And with that, I'm going to turn it over to Courtney Badger, who you must listen to. She who will be obeyed. Courtney, thank you.
Thanks, Mark. Good evening, everyone. I'm Courtney Badger. I'm with the county's Department of Community Planning, Housing and Development. I'm going to briefly go over the site's history and the applications that county has received before turning it over to Adrian with VHC Health to walk further through their proposal. The site that we're discussing is 601 South Carolyn Springs Road. It's currently within site plan number 140. Site plan number 140 includes the subject site, which VHC is proposing to build on. It also includes the existing medical office building and parking garage, which is south of the site, and it includes the northern portion of the site that has the existing surface parking lot on it. On the next slide, you'll see a closer look of the site. The VHC proposed site is outlined in red here. The area to the north and the south, again, is within that existing site plan, but it's not within VHC's proposal. As Mark mentioned, the site has history of hospital uses. Starting in the 1960s, there was a hospital that operated by right on the site. Over time, it evolved and included urgent care uses, and they were physically connected to the medical office buildings to the south. Through a series of real estate transactions related to the main VHC campus, the county acquired this property in 2019. And in 2020, a site plan amendment was approved to formally separate or decouple that former urgent care facility from the medical offices, allowing it to be demolished. In 2023, the county and VHC signed a letter of intent. And in late last year, VHC submitted an application that's currently under reviewed and that we're kicking off the public process for. Those applications include a site plan amendment and a use permit. Both of these are required by the SD zoning district that governs the site, and they will both be considered concurrently at the county board. Prior to going to the county board, this project will be considered by the site plan review committee, which Commissioner Patel will speak to that process in a few minutes. After the SPRC, the project will be heard by advisory commissions, including the Community Services Board, the Planning Commission, and Transportation Commission, and these groups will make a recommendation to the County Board. We hope that you follow along through the process. We maintain a project website that we update regularly. This QR code will take you to that website. All the materials that are submitted via VHC are linked to through this page. You can also keep up with events, meetings, engagement opportunities that are going on under the public process section, which you can see here. Starting today, we will have an online engagement portal that is open. It has videos from staff and from the applicant explaining the proposal and written staff report and plans that you can look through and put in your questions and your comments about the proposal. Thank you so much for taking the time to come out tonight. I look forward to seeing everyone through this review process. And with that, I'm going to turn it over to Adrian with VHC Health.
Thank you, Courtney. Good evening, everyone. I'm Adrian Stanton. I'm Vice President at VHC Health. Joining me tonight is Richard Krummenacker, who is the Vice President of Facilities and Construction at VHC Health. And we have several members of our executive and leadership team at VHC. On behalf of VHC and our board, and the partner LifePoint Health, we appreciate the opportunity to be in front of you tonight to talk about this important process and the behavioral health and inpatient rehabilitation hospital we intend to do on the Carlin Springs site, which we will call the VHC South Arlington South Campus. This project represents a unique opportunity to address an important community need. In addition to significantly increasing our bed capacity and space for these specific uses, we'll also be able to add much needed inpatient and outpatient adolescent services. As a designated level 2 trauma center, this project also provides us an opportunity to increase our complex stroke, trauma, and neurological services. Today, our treatment space is limited by the constraints of our busy hospital campus. For both the behavioral health and inpatient rehabilitation services, this project provides a unique clinical setting that fosters healing and safety. And we're excited to bring this world-class environment to the patients we serve. Providing this facility is a significant investment, and we're grateful for the cooperation and support from Arlington County and other stakeholders we've been working with. On our side, the initial investment estimates are our cost to deliver the facility will be about $160 million, which we'll be doing in partnership with a high-quality national provider, LifePoint Health. Next slide, please. In a challenging industry, this particular type of care has become more difficult to deliver and unfortunately less commonly offered. Most hospitals have stopped providing behavioral health, but instead of declining or eliminating those services, VHC has chosen a different path in expanding them. Even though we've provided behavioral health for over 35 years, we don't have experience in running a standalone behavioral health or rehabilitation hospital. That's the critical reason we'll be working with LifePoint. They're an organization with vast experience and expertise in the provision of patient-centered care. They're a strong fit with VHC based on their unique culture, which matches ours and sets us apart from other healthcare providers. With over 49 inpatient rehab hospitals and 26 behavioral health hospitals, LifePoint represents a proven expert who's been the choice of major healthcare systems across the U.S. A great fit for VHC, and more importantly, a good fit for our community. Next slide, please. This is a bird's eye view of the site, conceptual. This is looking south to north. So on the bottom right-hand corner is the medical office building and garage. And you look at the backside of the facility heading north. Next slide, please. This is another view of the campus, this one from Carlin Springs Road, looking west to east. In addition to the landscaping plan we'll have on this site, this gives you some perspective of how we'll incorporate existing vegetation with new. Next slide, please. In the Commonwealth of Virginia, hospital inpatient beds are regulated by the Virginia Department of Health. We have already gone through that process and have received state approval to add much needed inpatient beds for both behavioral health and inpatient rehabilitation. This facility will be 146 beds. 96 beds will be behavioral health, 50 beds will be inpatient rehabilitation. This is all planned to be done within a structure that is 3 levels, 2 levels above grade, 1 level below grade, which is the parking. Next slide, please. With this project, we'll also be able to expand our outpatient services. When we first started this program and we first started talking to the county about this program, we had 1 outpatient program, an intensive outpatient program. With the completion of this facility, we'll have 6 outpatient programs addressing both adult and adolescent patients. Next slide, please. As I noted at the outset, we are extremely excited to begin this formal review process. We look forward to the dialogue with all of the various constituents as we move closer to our ability to open this much-needed community benefit. Thank you.
Good evening, everyone. My name is Devanshi Patel, and I serve on the Arlington Planning Commission. So I am chairing this SPRC, and SPRC stands for Site Plan Review Committee. My role tonight is to explain what the SPRC is, how the public review process will work, what the timeline looks like, and how and when the community can participate as this proposal moves forward. I want to emphasize at the outset that tonight is the beginning, as Susan said, it's the beginning of the structured and multi-step public review process. Okay, I think we're on the next one, right? Are we on slide 21? Yes, thank you. The Site Plan Review Committee, again, SPRC, is a subcommittee of the Planning Commission. It's comprised of representatives from various stakeholders in the county. And the SPRC plays a very specific role in Arlington's development review process. It serves as the community's forum for reviewing special exception development requests, like the proposal that is being discussed tonight. The SPRC also facilitates a discussion amongst the applicant, staff, and of course the community. The SPRC develops information for the Planning Commission's review and advice, and that advice, of course, ultimately helps inform the county board's decision. I do want to make one important clarification. The SPRC does not vote, and it does not make recommendations. Its role is to identify issues, surface concerns, and work toward clarity, not to make final decisions. An SPRC is formed specifically for each project, and it includes representatives from key stakeholders. And for this particular project, the SPRC includes the Planning Commission, civic associations representing nearby neighborhoods, and a number of advisory commissions that bring expertise on topics such as transportation, aging, disability access, environmental issues, and community services. Each civic association and designated advisory commission has 1 representative at the table, and this structure helps keep the conversation manageable while still ensuring that a broad range of perspectives are being represented. Even if you are not an SPRC member, the meetings are open to the public, and there are multiple ways to follow along and share input, including, starting today, the county opened a 10-day online engagement period. So this is your first formal opportunity to review project materials and submit feedback. On the project webpage, there is a written staff report, a video presentation from the applicant walking through the proposal, a video presentation from county staff providing background and context on the site plan amendment and use permit applications. The engagement portal will be open for comments and questions on a wide range of topics, including land use, site design, building architecture, transportation, and landscaping.
Please use the online portal because every comment and question submitted will be reviewed and used to shape the agendas for the upcoming SPRC meetings in May and June. Please do note, however, that the online engagement window is time limited and it closes on April 30th. So please do take time to review the materials and share your thoughts while the portal is open. Please also take the opportunity to attend the walking tour on April 24th, this Saturday at noon, and see the site in person with county staff and the applicant team. All materials and the comment portal will be accessible through the project website. We will share the link with you, and it's also available via the QR code that was on slide 10 from tonight's presentation. In addition to the online engagement, there are several ways for the public to participate during this process. Again, you have the walking tour on Friday, April 24th, from noon to 1, Friday. This will be the chance to see the existing conditions of the site. Please be aware that this site is vacant, and the tour will take place partially through the vacant site and some uneven terrain and some natural conditions. And so we do ask that you wear closed-toe shoes, preferably long pants, just because, again, even though the site will be mowed, there are some natural conditions there. In May and June, there will be SPRC meetings that are hybrid and open to the public, and they can be attended live. Recordings are available afterwards on the county's magnificent YouTube page. Time permitting, there's also opportunity for public comment toward the end of each SPRC meeting. In addition, there'll be formal public hearings later in the process before the Transportation Commission, the Planning Commission, the County Board, where public testimony is also part of the official record. And then finally, the slide, this slide shows the draft timeline for this project. The dates are targets, of course. They are subject to change. The project website is a great resource to visit and stay up to date on the project schedule and upcoming meetings and milestones on the project. So we're excited to launch this review with you. We look forward to engaging with you. And with that, I will turn it over to Deborah Warren with the county's Department of Human Services. Thank you.
Good evening, everybody. Wow, this is so exciting to see all of these folks here. All of you are interested. So my job is to talk about the need, there you go, thank you, the need for this project. But I have a hunch that I don't really need to do that because looking at the faces in this audience, I think you all have a sense of the need. But let me just highlight a couple of points on this really busy slide here. With regard to Northern Virginia, I'm just going to give you 1 in 4. That's what you have to remember. 1 in 4 adults have mental health symptoms. 1 in 4. So if you think about your own family, friends, colleagues, you know that that's an issue. For youth, it's 1 in 7. And that's really important because 50% of all mental illnesses really start around age 14 and 75% by age 24. So we want to get in there early and intervene early. And this project will, for the first time, enable us to do so because of the access to adolescent beds. With regard to Arlington, you can see here that at least 210 individuals have boarded in the emergency department, VHC's emergency department specifically, for more than 8 hours since the beginning of the fiscal year, that's July 1. And nearly 40 have boarded 4 days, and some for many days. This is not okay. In 2014, the state General Assembly passed the bed of last resort. And this law required that state-operated psychiatric hospitals admit individuals under a involuntary temporary detention order when no private or local hospital bed was available. And the idea was to ensure a safety net for individuals in a behavioral health crisis. Unfortunately, this has led to a significant capacity strain. And today, the state hospital system is not just full, but overflowing with individuals in cots, in group rooms, and in seclusion rooms. There are, as of 4 p.m. today, 126 individuals waiting for a state psychiatric bed. These are about a little more than half waiting for a civil commitment bed, which is almost impossible to get these days, and 51 are waiting for a forensic bed. Those are individuals who are waiting in the jail. The civic commitment patients are waiting in emergency rooms. And 11 kids. There are only 24 state hospital beds for children in the entire Commonwealth of Virginia. And by the way, the number of individuals waiting for a state psychiatric bed this afternoon, it's a 15% increase over last week when I told my boss there's 110 people waiting. These are not therapeutic environments to spend the worst day of your life. It's not okay. And that's why we're very excited about this project. So with regard to Arlington, 20% of individuals under an involuntary commitment had to go out of the area, out of Northern Virginia, far away to get the care that they needed, involving, long transportation and being separated from families and from their communities, removing them from their supports, but also making discharge planning with community supports that much harder. At the county level, we've been building out our crisis continuum of care. Many of you have heard about it. Our crisis services increased by 7%, or utilization increased by 7% just in the last year. And despite building out our crisis continuum of care, it's just not enough. We need those beds. Now, the good news, next slide, please. There you go. The good news is, over the last decade, VHC and the Department of Human Services have partnered with a behavioral health community advisory group, previously known as the stakeholder group. Many of you are here today, thank you. This group came together in 2016 and consists of individuals and family members with lived experience of actually being on a psychiatric unit or having a loved one on the psychiatric unit, as well as community services board members. These are individuals who are volunteers who are appointed by the county board and oversee the county's behavioral health and developmental disability services, as well as numerous other behavioral health advocates. This group met monthly for a decade, 10-year anniversary, with VHC and DHS senior staff to develop a joint data-informed methodology to come to an agreement about the number of behavioral health beds we needed to add to Arlington. VHC heard the voices, not just about the number of beds that are required to meet the growing need, but also this group advocated for adolescent beds for all the reasons you can imagine. And VHC heard that. We are going to get beds for our youth. This group advocated for step-down options, and you heard Adrian talk about the 6 outpatient services that are going to be added. This is not just about inpatient beds, this is about a full continuum of behavioral health services. This group advocated for biophilic nature, natural light, outdoor spaces, therapeutic environments. We're going to get that in this facility. The group also advocated to ensure that there was a high proportion of private rooms for those individuals who are not comfortable having roommates. So, 100 hours of collaboration and more to come. Next slide, please. All right. So, the impact for Arlington, the wellness impact for Arlington. With the addition of these 96 behavioral beds at the Carlin Springs campus, plus the 14 beds for medically compromised individuals who also need behavioral health care at the main campus, and all of those outpatient services described, Arlingtonians will have faster access to inpatient and outpatient behavioral health care for adults and adolescents, filling an enormous gap, ensuring early intervention and a brighter future for our youth. Arlingtonians will spend fewer hours, fewer days boarding in the emergency department. They will go immediately to a beautiful, trauma-informed environment, a healing environment. Arlingtonians will receive care close to home, family, and community supports. Overall, this facility will support aftercare and discharge planning and result in an Arlington that is safer and stronger. We know that brain health is health, right? The proposed VHC services are as critical to our community as cardiac care. This proposed wellness hospital is as essential as a fire station. Arlingtonians will get the timely help they need when they need it and experience more good days. Thank you.
All right. Thank you all to all of our, that's not my name. That's okay. But thank you all to all of our presenters here. Hopefully you guys got some good information to take with you out into the lobby area. And we are going to transition now to the open house portion of the evening. So just outside the room, you're going to find a handful of information stations. Each station is staffed by different county departments, and we'll give you an opportunity to have some one-on-one or two-on-one or three-on-one conversations, ask questions, and share your thoughts. There's no formal program during the open house, so please feel free to move around at your leisure and what you are interested in talking about, and whichever station would be most helpful to you as you start to engage in this process. The event is designed to be an open and welcoming space. We know there are a lot of differing viewpoints on this project, and we ask that everyone engage respectfully and allow space for all voices to be heard. Our goal tonight is to listen and learn from one another and support a productive and civil discussion. We'll also have comment cards available if you prefer to share feedback in writing, and staff can point you to where additional project information and future meeting updates will be posted. I'm going to put a plug in. There are little cards on every table with a QR code where you can go directly to sign up for the newsletter on this project, so you can get immediate updated information into your inboxes. So the open house will remain open until 8:30. We do have a hard stop at 8:30, and we hope that all of you will recognize that and help be cooperative. We have a lot of people here that will need to move through. And at the time, we will begin asking attendants to wrap up the conversations. But this is the beginning. I'm going to say it again. This is the beginning of the conversation. And so there will be a lot more opportunities for you all to provide your input. So thank you again for being here and participating in this conversation. And now the floor is open.